Welcome everyone to this lunchtime webinar on glutathione and its precursors. This is a very, I think this is a very compelling presentation that most health practitioners should be aware of. So without further ado, let's get started. So glutathione as an antioxidant and a detoxifying agent is really just 3 amino acids strung together. It's glycine attached to cysteine attached to glutamic acid. And a lot of glutathione is made in the liver and the kidneys for their own purposes. So the liver uses a lot of glutathione, and the kidneys also require it to a significant degree. And for the most part, as you're going to see, the cells of the body have a lot of access to glycine and glutamic acid, but getting cysteine is much harder. So some of the cysteine that the body will utilize for glutathione is actually made through what's called the transsulfuration pathway, which we'll see later, where the body converts some homocysteine into cystathionine and then into cysteine with the help of vitamin B6. So just hang on to that for now. We'll come back and revisit it. So some glutathione in the liver is released systemically, but once it gets into the blood, a lot of it gets decomposed. So the liver concentrations of glutathione are much higher than blood concentrations. The other thing is that glutathione can't directly cross the blood-brain barrier at sort of physiological concentrations. However, I've worked with a number of integrative medical doctors who when I'm working with Parkinson's patients, I get them to give the Parkinson's patients intravenous treatment with glutathione. If you can get the blood concentration high enough, some of that glutathione will get across the blood-brain barrier and can be very helpful as an adjunctive treatment in Parkinson's disease, which we'll get into a little bit later. The 2021 review indicates that the glutathione made in the liver that's released into the bloodstream doesn't really get into a lot of the peripheral cells of the body, but there's evidence to show actually that some of that glutathione can be taken up into the cells and used as glutathione. But the cells of the body really do need to get access to the amino acid cysteine. The more cysteine they have, that's sort of the rate limiting step in how much glutathione they can synthesize. And that's why giving people supplements like N-acetylcysteine is so effective at raising cell concentrations of glutathione, as we will see. So the way that you form glutathione is, again, with glycine attached to cysteine attached to glutamic acid. And once these things sort of form bonds, you see what glutathione looks like chemically here on the right-hand side of the page. But it's glycine with cysteine and glutamic acid, but the cells often don't have enough cysteine to optimize their glutathione synthesis. That's the key point here. Sometimes individuals can inherit a genetic defect in the glutamate cysteine ligase enzyme, in which case, even if there's enough cysteine, it's very hard for the cells to make adequate amounts of glutathione, or they need higher amounts of cysteine in order to drive that pathway. So that genetic defect can lead to glutathione depletion over time that comes in and can be a factor in some genetically based neurodegenerative diseases, as we will see, as we'll touch on later on. At the cellular level, glutathione functions as a water-soluble antioxidant, and also it's very much involved in detoxification reactions within the body, helping to guard against dangerous substances. It's the most abundant cellular thiol that acts as a major antioxidant defense, especially quenching hydrogen peroxide, which is a byproduct of oxidative phosphorylation. So in the mitochondria of the cell, as the electrons are being shunted down from one cytochrome to the next, some of the electrons, as I've told you in previous webinars, leaks out and can interact with oxygen and form, as you're seeing down here, the superoxide anion, where a hydrogen electron leaks out and you form superoxide anion, which is quenched normally by superoxide dismutase. But if it doesn't get quenched in time, then you get another hydrogen electron that forms hydrogen peroxide. Now, if that encounters a transition metal like iron or copper, that can split into 2 hydroxy radicals, which can be very damaging to the cell. This is where glutathione peroxidase steps in and donates hydrogen electrons to convert that into 2 molecules of water, which is very safe. So in doing so, the glutathione, as it participates to form water from hydrogen peroxide, it itself gives up its hydrogens and it becomes oxidized to the oxidized form of glutathione. And then the oxidized forms of glutathione can actually bind together and form oxidative glutathione that then is inactive, but it can be recycled by glutathione reductase, as we'll see shortly. But that glutathione largely is helping to remove hydrogen peroxide within the cells so that it doesn't cause a lot of free radical damage. So glutathione is consumed more rapidly and depleted upon ingestion of certain medications and environmental toxins that generate free radicals or require a great deal of detoxification, because glutathione is also involved in detoxification. Glutathione is really depleted in chronic liver infections and also in HIV infections. What you'll see is a number of slides here showing that in people with HIV infection, glutathione gets turned over very rapidly. And when glutathione levels within the liver and within CD4 cells or T helper cells, a type of T lymphocyte, becomes greatly depleted, that's usually when HIV infection starts to move more rapidly towards AIDS, which is, then a more terminal condition. So unfortunately, glutathione supplements are not well absorbed. So you say, well, we could give people glutathione supplements to raise their blood levels and their CD4 levels, but glutathione doesn't get absorbed very well. But supplementation with N-acetylcysteine, alpha lipoic acid, selenium from milk thistle, and L-glutamine are all proven methods to actually increase glutathione synthesis within the cells, including brain cells, as you'll see, and also in the immune system. The other thing is that if you have other antioxidants that can be the first line of defense against free radicals that are being generated, like vitamin C and vitamin E and beta carotene and so on, if you have higher levels of those intracellularly, your glutathione doesn't get used up as quickly, and you can preserve your glutathione sometimes for more important functions like detoxification. So higher intracellular levels of other antioxidants tend to slow the depletion of glutathione, which is very helpful, including in HIV infection and liver conditions. So a high-level overview of where it's beneficial to increase glutathione status in the body. Some of the considerations are in people over the age of 50, because as you get older, your glutathione synthesis decreases significantly, so the intracellular glutathione levels are much lower. And so free oxidative stress starts to build up more rapidly after the age of 50, as I will show you. Certain chronic liver conditions like non-alcoholic steatohepatitis, which now affects 25% of the world's population, that's fatty liver degeneration, as well as sort of chronic hepatitis C, and sort of drug and alcohol-induced liver damage. You want to raise glutathione levels to help slow down the damage to the liver that is under assault in these conditions. And especially you will in people using acetaminophen on any level of regularity, because as we'll see, acetaminophen generates very toxic free radical-based intermediates that require glutathione to be neutralized and conjugated into a form the body can excrete that's non-harmful. So as people use acetaminophen, they deplete the glutathione much more rapidly, leaving the liver cells very prone to a lot of damage from acetaminophen that can lead to liver failure. People just on multitudes of drugs, any kind of polypharmacy situation where drugs are having to be metabolized and detoxified by the liver, raising glutathione levels is a great idea, especially if they're on anti-seizure drugs, statin drugs, acetaminophen, or antifungal drugs, which really do a lot of liver damage. And if you want to combat environmental toxins and pollutants and common carcinogens in the modern world, keeping your glutathione level status more optimal makes great sense. And it can also help to slow kidney decline in early and moderate stages. It's a useful adjunct, particularly in Parkinson's disease, if you can raise glutathione levels, possibly in cerebellar ataxia, and useful in diabetes and prediabetes because it helps to reduce inflammation and free radical damage to the insulin receptor itself, and the receptor works better, and so it improves glucose regulation and insulin sensitivity. I'm going to show you this research. So over time, as we age, glutathione levels in the body decline significantly. So by age 50, you're seeing enough of a decline. It makes sense to be raising your glutathione levels to a higher status to slow age-related changes due to free radicals, and also to maintain normal detoxification within the liver. So here you see it also plotted out a different way. As glutathione levels decline, oxidative stress increases. Now, that doesn't have to happen. If you can get your glutathione levels to a more optimal state, then the aging process is going to ensue more slowly, and you're going to have better glutathione protection. Here's the decline in glutathione peroxidase, also in aging, that we see in published peer-reviewed journals. So glutathione is an antioxidant and also in recycling. So glutathione exists in its reduced state, but it can get oxidized in our cells. So as I said, glutathione donates hydrogen electrons to hydrogen peroxide to quench it and to help it to convert into water, so you don't have hydrogen peroxide and hydroxy radicals being generated. And so then the glutathione will then attach, the oxidized glutathione will also attach to other glutathiones that have been oxidized to form this disulfide oxidized form of glutathione. And there's so much glutathione in the cells that it can easily find another oxidized glutathione to match up with, and you'll see what that looks like momentarily. So here you see glutathione converting hydrogen peroxide into water, going from its reduced state to its oxidized state, but it can be recycled by glutathione reductase. So when it gets oxidized, two oxidized glutathiones attach together with these disulfide linkages. But then in the presence of NADPH, it can be recycled. Some of it can be recycled back to glutathione in its reduced state. Again, the cells can also produce more glutathione in the presence of cysteine. And alpha lipoic acid helps the cells of the body get access to cysteine by affecting what's known as the cysteine glutamate pump, allowing more cysteine to enter the cell, which will then get reduced into cysteine. So now you can raise your glutathione levels if you supplement with alpha lipoic acid. We'll see that in a moment. So here's what cysteine looks like. So here you see it's really just two cysteine molecules attached together by a disulfide linkage. There's a pump in the cells that pumps glutamate out of the cells and pumps cysteine into the cell. Once cysteine gets into the cell, this gets reduced quickly into two cysteine molecules. And the more cysteine you have in your cells, the more you can make your own glutathione to raise glutathione concentrations. As such, giving people supplements, especially with N-acetyl cysteine, can greatly raise intracellular levels of glutathione. And that's sort of the takeaway message here. Now, this brings us to alpha lipoic acid, because it's the master recycler of a lot of antioxidants. And alpha lipoic acid also raises glutathione levels. And the way that alpha lipoic acid raises glutathione levels is by increasing the amount of cysteine that gets pumped into the cells using the glutamate cysteine pump. So more cysteine goes into the cell. Once you have more cysteine in the cell, it can get reduced into cysteine. You have more cysteine that's available to make more glutathione. So that's how alpha lipoic acid raises glutathione levels. But alpha lipoic acid in its own right is a very potent antioxidant as well. In fact, as you'll see shortly, it's a water-soluble and a fat-soluble antioxidant. So it can work right in the fatty, waxy area of the mitochondrial membrane, quenching free radicals before they can even become the superoxide dismutase and do a lot of damage and become hydrogen peroxide. And alpha lipoic acid also recycles a lot of antioxidants back into their antioxidant states once they've been sort of used up as an antioxidant. So this sort of works this way, particularly when vitamin E is used as an antioxidant. It's going to form a vitamin E radical, but vitamin C, dehydroascorbate, can help to recycle vitamin E back to its antioxidant state. So vitamin E can keep acting as an antioxidant in the presence of vitamin C. But vitamin C gets recycled by alpha lipoic acid. So it's a beautiful little system. And alpha lipoic acid by increasing the amount of cysteine availability, increases glutathione synthesis as well. So you can recycle glutathione as well as vitamin C and vitamin E, possibly CoQ10, and also another enzyme that's an antioxidant in the cell that you see here, the thyrodoxin. So what I'm saying is that as glutathione gets used up, converting hydrogen peroxide into water, it gets oxidized, but it can be recycled back using glutathione reductase, but also alpha lipoic acid can also be a factor. Now, glutathione peroxidase also requires the mineral selenium. So you can make glutathione, but if there's not enough selenium in the body, then glutathione is not going to work ideally as an antioxidant. And as I said earlier, glutathione also helps maintain levels of ascorbic acid and tocopherol, vitamin C and vitamin E, by acting as a reducing agent. Conversely, vitamin C and vitamin E supplementation can also help to spare glutathione. If you have a lot of vitamin E and vitamin C, you don't use your glutathione up as quickly, so you don't deplete it as much because you have other frontline antioxidants that can decrease reliance on glutathione. So the alpha lipoic acid story, at least what's compelling to me, is that it recycles vitamin C and vitamin E to keep them as potent in their potent antioxidant form. And by getting more cysteine into the cell, it allows the cells to make more glutathione on their own. So what we have seen so far is that supplementation with N-acetylcysteine and supplementation with alpha lipoic acid help to increase glutathione synthesis in the body, but they're also serving other medicinal properties on their own. You'll see, as we showed here, alpha lipoic acid is also mastering other, recycling other antioxidants and acting as a fat-soluble antioxidant, which glutathione cannot do. It's a water-soluble antioxidant. Glutathione and detoxification. Well, glutathione conjugates a lot of free radicals that are formed in phase 1 detoxification from xenobiotics, these things in the environment, environmental toxins and drugs and antibiotics that can do a lot of damage. So glutathione is an important conjugating agent in phase 2 to prevent these agents from having tremendous damage, especially to the liver. So in the modern world, liver detoxification capacity can easily be overwhelmed by all these environmental toxins and drugs people are on, a lot of antibiotics that are, 85% of all the antibiotics that are used are actually used in animals, as cows and pigs and chickens and so on, to keep them disease-free and to also kill off the microflora in their own intestinal tract, so more of the nutrients will be used by the animal body, so they'll grow faster, they'll fatten up a lot faster, and they can be then butchered and used for human food. So we're getting some of these byproducts in the foods that we eat. So in the modern world, glutathione depletion can occur very easily from all these different sources. So having a way to maintain your glutathione status makes really good sense. So here we see in the liver that in both phase 1 detoxification and in phase 2, you need glutathione. Glutathione in phase 1 is acting as a reduction agent. It's donating hydrogen electrons to help to detoxify things. But very often at the end of phase 1 detoxification, you're left with an intermediate molecule that's even more dangerous than the original agent that came into the body, the pesticide, the herbicide, the end product of metabolism, the hormones, whatever it is. And then you need phase 2 conjugation to occur. And you'll see that glutathione plays a very important role in conjugating a lot of dangerous molecules, converting them into a water-soluble form that's biologically inactive so the body can excrete it through the urine or the feces. And notice also that other conjugating agents, amino acid conjugation, also relies on cysteine by itself, and also on glycine by itself and glutamine by itself. These are other agents that are important in glutathione synthesis. So by providing more cysteine and glutamine, as an example, not only are you raising glutathione levels, but you're also getting more of those amino acids that are used, just themselves as amino acid conjugating agents in phase 2 detoxification. So these nutrients play a key role With respect to acetaminophen, the first thing I will tell you is that acetaminophen is the leading cause of drug-induced liver failure in this part of the world. Now, 50% of that are people who are trying to commit suicide by just putting the whole bottle of acetaminophen into their body. But 50% of drug-induced liver failure from acetaminophen is people just using it at the regular prescribed dosage. Just slowly over time, this intermediate of phase 1 detoxification that we'll just call the NAPQI starts to build up, which causes a lot of free radical damage to liver cells. But it's normally glutathione that would step in and conjugate that and neutralize it so the body could excrete it safely. But as people use acetaminophen day after day, even at the prescribed dosage, it starts to deplete their glutathione levels. And when you get to a critical level of depletion of glutathione in the liver, the NAPQI starts to build up sort of, unaffected by conjugation. So you have tremendous liver damage from acetaminophen end products of metabolism that are not properly being detoxified. And so the truth is that if somebody has an acetaminophen overdose, it's acute, the actual medical treatment to prevent death from liver failure, because that's how they die, and kidney failure, is by IV administration of N-acetylcysteine. But even if you give them high oral doses of N-acetylcysteine, sometimes that in itself, before they get to the hospital, can actually help preserve liver function. And by raising glutathione levels and quenching the NAPQI before it can do extensive damage. Now, other drugs also damage the liver. It's not just acetaminophen. Anybody that's polypharmacy, you see these people on all these 3, 4, 5, 6, 7, 8 different drugs. There's glutathione depletion happening. They need to be raising their glutathione levels. So health practitioners should employ strategies to guard against drug-induced liver damage by educating people on how to reconstitute their liver glutathione. And of course, I'm going to show you the product Adëeva Ultimate GLX, because I think it's the very best one for reasons which will become self-evident very shortly. Glutathione also converts fat-soluble toxins into water-soluble forms. So when things are fat-soluble, they get stored in the body for years and decades, and they can build up and do a lot of damage. Glutathione can help convert them into water-soluble forms that can be excreted safely. That's very important. And also guarding against other sort of natural end products of metabolism that can be damaging as well. Glutathione in the immune system, the CD4 cells and the CD8 cells that we talked about a lot in immunity. They're sort of the CD4 cell is the quarterback of the whole immune system. It's also called the T helper cell, and it comes in two forms, the TH1 and the TH2. And glutathione is required for those T helper cells, those CD4 cells, to synthesize all the different cytokines that are necessary to coordinate a proper attack against any kind of a threat to the body in terms of infection, including HIV infection. So in HIV patients, as glutathione levels fall, you start to see a greater tendency for the disease to start moving towards AIDS. And again, this slide is basically saying the same thing. In HIV patients, a lot of the glutathione is in the oxidized form because it's already been used up. And when it gets to a critical level of depletion, then there's a much greater likelihood that HIV will move into AIDS. And people who are, drug users with injectable drugs often deplete their glutathione. And as the glutathione becomes depleted, they're much more likely to accelerate their time before they actually will die from an injection. And it appears that glutathione, if you can raise glutathione, it slows the progression of HIV infection in many cases because it blocks the activation of these inflammatory cytokines like tumor necrosis factor alpha, and inhibits the reverse transcriptase, which is a major enzyme that's necessary for HIV replication. So of course, you have these reverse transcriptase drugs that are out there, but glutathione levels also help to support that as an ancillary intervention. So HIV patients often take supplements to raise their glutathione levels, such as N-acetylcysteine and L-glutamine, but also you'll see the role of alpha lipoic acid and I'm not sure if there's studies on Silymarin, but there ought to be. Glutathione, brain and neurodegenerative diseases. So glutathione depletion in the brain is a common finding in people with Alzheimer's and Parkinson's disease and other neurodegenerative conditions. There's a sodium-dependent, the glutamate cystine pump that has to work to get cystine in there so you can make glutathione. Genetically, some people maybe have a pump that doesn't work that well, so they're looking at that as a new target for drug therapies to actually improve the function of that pump. But any way that you can raise glutathione is helpful, we think, to help prevent some of these conditions and as an adjunct in the management. So it's the astrocyte cells in the brain that actually synthesize most of the glutathione, then they provide it to the other brain neurons. So the astrocytes use that glutamate cystine pump so they can get cystine into the cells, and then they convert that into cysteine. But remember, cysteine, unlike glutathione, cysteine can cross the blood-brain barrier. That's why giving people N-acetylcysteine can raise brain levels of glutathione. That's a very important point to keep in mind. And studies using proton magnetic resonance spectroscopy, sort of a non-invasive technique for detecting various neurochemicals in the brain, including glutathione, has shown that brain glutathione levels appear to decrease in age-related neurodegenerative diseases such as Alzheimer's and Parkinson's, and also in ALS. An initial study in the postpartum brains of Parkinson's patients reported decreased glutathione levels in the substantia nigra of the midbrain, which is where Parkinson's disease occurs, these dopaminergic nerve fibers, suggesting that a decrease in glutathione in this area may be a critical part that leads to the onset of Parkinson's disease. There's very good evidence for this. In animal models, when they expose animals to this chemical, it's sort of like a insecticide, pesticide, herbicide known as the MPTP, it leads to glutathione. But if you pre-administer N-acetylcysteine and you give the animal then exposure to the MPTP, they don't develop Parkinson's disease to the same degree. It has a protective effect. So it might be that certain chemicals cause a depletion of glutathione that then leads to the triggering of Parkinson's disease as part of the Parkinson story. A recent study using that type of imaging demonstrated that intranasal administration of glutathione significantly raised glutathiones in the dorsum putamen of patients with Parkinson's disease, suggesting that nasal administration may help to maybe the blood-brain barrier is not nearly as strong using nasal administration as sort of bloodborne. So I think what you're going to see in future research is sort of nasal administration of certain substances to get them into the brain more effectively. But I will tell you from personal experience that giving patients with certain neurodegenerative conditions IV treatment, high-dose glutathione, that it can very much help to stabilize conditions for a while, and then they'll need another dose as the glutathione level gets depleted. What about glutathione depletion in Lou Gehrig's disease? Well, we do know this, that genetically mutations in the superoxide dismutase 1, so there's 3 different superoxide dismutase enzymes, and it's the defect of superoxide dismutase 1 that causes a lot of the genetic related ALS conditions. And the overexpression of that, certainly leads to what's known as the ALS phenotype, also in rodents. However, in mice that have the hemizygous form, that means only one of the alleles carries the mutation for superoxide dismutase defect, that they only develop all Lou Gehrig's disease when glutathione levels become depleted. It may suggest that in people that are genetically susceptible to Lou Gehrig's disease, in some cases where it's more the heterozygous form, not the homozygous form. So homozygous means that, for each genetic trait, there's 2 alleles. And when you have a homozygous form, both of them are mutated. So that gives you, there's a very strong likelihood you're going to develop the disease. But in heterozygous or hemizygous forms, one of the alleles is normal and one is abnormal. In those situations, maintaining higher levels of glutathione in those patients may actually help to prevent the onset of ALS. So that's research to keep your eye on. And I'll just point out to you, there's also very good research on maintaining melatonin levels to prevent the onset of ALS. There's some good evidence on that because melatonin helps to preserve the anterior horn cells from atrophy and apoptosis, which is the key finding in Lou Gehrig's disease. More about that in another webinar. The thing that I want to come back to here is that if you can get other antioxidants into the cells at higher levels, you start to preserve your glutathione levels for all kinds of important functions, so you're not using it up so quickly. And that's why when you're supplementing with 1,000 milligrams of C every day, 400 IUs of vitamin E, 100 to 200 micrograms of selenium, also needed for glutathione peroxidase, some beta carotene, vitamin A, that you're already slowing down depletion of glutathione, which is a great thing. But if you want to raise your glutathione levels further, as you would in certain clinical situations and in the aging process, then the best way to do that, as you're going to see, is by supplementing with a combination of N-acetylcysteine, alpha-lipoic acid, selenium from milk thistle, and L-glutamine. And each of these agents that raises glutathione also has its own other independent medicinal properties. So N-acetylcysteine is proven to increase intracellular glutathione levels. That's not open for debate. We know that happens. And then, of course, in acetaminophen overdose, the N-acetylcysteine is used successfully to treat hepatic and renal failure secondary to acetaminophen overdose. But N-acetylcysteine is also, in and of itself, fantastic at heavy metal chelating, of removing certain toxic metals from the body, like methyl mercury from fish, and lead, and gold, and arsenic, and cadmium, but also in people that have hip prosthesis, where the cobalt and the chromium starts leaking out. It can also help to keep tissue and blood levels lower if you're supplementing with N-acetylcysteine. You see the scientific references there. N-acetylcysteine has also been shown to elevate glutathione in immune-compromised states, again in HIV states, as a part of the adjunct of nutritional management. And it's all can slow certain cases of chronic kidney disease, very, very important, especially in diabetic patients where kidney function is declining over time. So glutathione is helping to improve insulin receptor function, but by giving N-acetylcysteine to raise glutathione, you're also slowing the progression of kidney disease. That's vitally important to appreciate. And also in chronic liver infection with hepatitis C, evidence showing that the adjunctive management with N-acetylcysteine very effective. For people that have pulmonary diseases, including asthma, N-acetylcysteine can have mucolytic properties to a certain degree when you're supplementing at significant doses. And when it's used orally or inhaled via nebulization, and people that have serious lung problems like primary pulmonary fibrosis, an autoimmune disease where the life expectancy is only 3 to 5 years once you're diagnosed with that, or if it's a pulmonary fibrosis secondary to another autoimmune condition like in scleroderma, then nebulization, you need medical doctors to do this supervised, but you're basically inhaling an aerosol version of N-acetylcysteine, decreasing oxidation, decreasing inflammation to help preserve lung tissue and to improve oxygen diffusion into the bloodstream. Anyway, it's multi-purpose. What about alpha-lipoic acid? It's the only water-soluble and fat-soluble antioxidant that we know of other than melatonin. And both melatonin and alpha-lipoic acid, remember, they decline as you get older. But alpha-lipoic acid has also been shown to raise glutathione primarily by increasing cysteine getting pumped into the cell, where it then allows more cysteine to be used to make glutathione. And alpha-lipoic acid, as we saw earlier, helps to recycle vitamin C, which can then also recycle vitamin E. So it's a master recycler. It's been used successfully to raise glutathione in HIV patients and help block the further progression of the disease, like N-acetylcysteine and L-glutamine. We saw that earlier. And here's an actual clinical trial, 450 milligrams of alpha-lipoic acid. What's something that's a bit ambiguous here is that alpha-lipoic acid, the abbreviation is ALA, but ALA is also the abbreviation for the kind of essential fat that's found in flaxseed oil, which is alpha-linolenic acid. So don't get confused. They both use the same abbreviation, unfortunately. But in this instance, we're referring to alpha-lipoic acid as ALA. It's also been shown to help in diabetic and pre-diabetic patients, increasing insulin sensitivity. So alpha lipoic acid itself helps to decrease free radical damage to insulin receptors and decrease inflammation. So one of the things that's happening in diabetes in the background is there's increased oxidative stress and more of an inflammatory component. Alpha lipoic acid and glutathione both help to reduce that, improving insulin receptor function, improving diabetic control. It also protects the central nervous system from free radicals, which makes it a very important nutritional consideration in cases of neuropathy, particularly diabetic polyneuropathy. Alpha lipoic acid is sensational. So it has its own medicinal value over and above just raising glutathione levels. So it's multi-purpose, and because it's declining with age and has so many clinical considerations, this is a very important antioxidant, multi-purpose nutrient to know about. The other thing is that when you metabolize glucose in glycolysis in your cells down to pyruvic acid, generating just a couple of ATP, then pyruvic acid, remember, is going to go into the mitochondria and become acetyl coenzyme A, and via the enzyme pyruvate decarboxylase. But that enzyme requires alpha lipoic acid. So as alpha lipoic acid declines as you age, the ability to burn fuels, glucose in particular, carbohydrates, is compromised in your body because less of it is going to be converted to acetyl coenzyme A, bind with oxaloacetate to form citrate, and go into the Krebs cycle. So by giving people alpha lipoic acid after the age of 50, you're also increasing energy synthesis for them. And 98% of your energy is actually produced through the Krebs cycle. The other enzyme that requires alpha lipoic acid is alpha ketoglutarate dehydrogenase, converting alpha ketoglutarate into succinate here in the Krebs cycle. So it's generating energy. And alpha lipoic acid, when it declines with age, energy production declines. So when people take a supplement, alpha lipoic acid, it's like taking CoQ10. They tend to find they have more energy. But that's the reason why. So remember, back here in the mitochondria, CoQ10 is helping to shuttle hydrogen electrons down. And CoQ10 is also declining with age. So you need, by the time you're 45 or 50, you should be taking, cardio essentials from Adeeva, in my opinion, to maintain your CoQ10 levels. But some of those free radicals some of those electrons going down the cytochrome chain are leaking out and forming superoxide anion, and you need superoxide dismutase to quench that. Well, superoxide dismutase, remember, it needs zinc, manganese, manganese, and and not selenium. It'll come to me. Zinc, manganese, and what is the other mineral that's required? We'll visit it in a second. I should know this off the top of my head. And also, again, glutathione here, quenching hydrogen peroxide. But remember that superoxide dismutase and glutathione, but also alpha lipoic acid and CoQ10 also work in the mitochondrial membrane to quench free radicals. And so as you get older, your glutathione levels are dropping, your alpha lipoic acid levels dropping, and your CoQ10 is dropping. So you're getting way more oxidative stress within your cells. And so by taking supplements to maintain that is a very critical factor in anti-aging and in normal energy metabolism. So here's an excerpt from the journal Biomolecules in 2019. Alpha lipoic acid has numerous clinical valuable properties. It acts as an enzymatic cofactor. It's involved in glucose and lipid metabolism. It manages gene transcription. It acts as an antioxidant because it not only improves, but also restores intrinsic antioxidant systems like vitamin C and vitamin E and glutathione, supports their production or cell accessibility, as we talked about. It also efficiently removes heavy metals from the bloodstream. Just like N-acetylcysteine removes heavy metals, so does alpha lipoic acid. Alpha lipoic acid also improves glycemic control, alleviates diabetes, mellitus complications, and even symptoms of peripheral neuropathy at the same time that it effectively lessens heavy metal toxicity. So this is, just very recent published data to show the value of alpha lipoic acid just on its own. Other considerations for alpha lipoic acid in Parkinson's disease, there's also some promising human clinical evidence where you use it in Parkinson's disease alongside N-acetylcysteine. They both have shown very positive results in some clinical studies. Experimentally, it's been used effectively in Alzheimer's disease, Huntington's disease, and also in age-related memory loss. We're waiting for more human clinical studies to confirm that. There's a genetic condition known where people form kidney stones due to genetic cystinuria. This is where cystine builds up and it becomes very insoluble and it forms stones. Giving people high doses or just normal supplementation doses of alpha lipoic acid, as I would call it, increases the solubility of cystine, decreasing or increasing the ability of the body to solubilize cystine and excrete it in the urine where it's not now forming stones. So there's some good evidence on that as well as another clinical application. Now, milk thistle also raises glutathione levels. So what's unique about milk thistle, a standardized grade of milk thistle will be very rich in the flavonoids known as selenium. It's sort of a combination of these flavonolignans. In 1986, the German commissioner approved oral extract of milk thistle standardized to 70% crude selenium. You can now get doses, you can now get standardized selenium of 80% as a treatment for liver disease. It really works well in the liver. It increases liver glutathione by over 35% in healthy people and by over 50% in animal studies. As noted previously, glutathione is not only an antioxidant, but it's required for phase 1 and phase 2 detoxification function within the liver, facilitating detoxification of xenobiotics, drugs, and carcinogens. The ability of milk thistle to help restore liver glutathione level is considered to be a primary means by which selenium has been shown to be an effective treatment for various liver diseases. It also stimulates RNA polymerase and DNA synthesis, so it also helps to repair liver cell damage. And that's critically important. You're going to see an incredible case study here in a moment. So it can stimulate regeneration of the cell, raise glutathione levels. So it's extremely important for liver cell repair and possibly new liver cell formation. As such, selenium has been used to aid in the repair of liver cells that have been damaged by hepatitis C, alcohol, and other damaging chemicals. It's also been shown to raise superoxide dismutase, which quenches the superoxide anion, a very powerful antioxidant that all cells are happy to have more superoxide dismutase if they can get it. In 2020, there was this fantastic report in the journal Today's Dietitian. So this is a remarkable study of a California medical doctor who done his own research. He saved a life, because this was not taught in medical school. He saved the lives of almost an entire family after he got permission from authorities to use milk thistle to treat family members who had fallen very ill after they inadvertently ate the death cap mushroom. They were out camping and they started collecting mushrooms that they thought were safe, realizing after they ingested a very poisonous mushroom that was going to soon cause liver failure from tremendous free radical damage. In a timely manner, Dr. Todd Mitchell, who went and did some research on this, administered a high-yield selenium milk thistle supplement that had 80% standardized grade to family members, which saved the lives of all 6 family members, except for the 83-year-old grandmother. There are no drugs that can do this, by the way. So selenium saved the life of people who had ingested a known liver toxin. That's just an incredible story that happened just very recently. And as I've told you in previous webinars, milk thistle also has immune modulating effects that are very significant. They can help the body raise its ability to fight all kinds of viral, bacterial, and other types of infections. So it's not just about glutathione, detoxification, liver repair, but day-to-day intake of milk thistle helps to keep your immune system primed, especially after the age of 50 when the immune system is undergoing decline usually. What about L-glutamine? Well, L-glutamine has also been shown to enhance glutathione stores in conjunction with N-acetylcysteine. It's been shown because glutathione also, glutamine is also the primary fuel for the intestinal epithelial cells. It helps to protect them against certain chemotherapy agents, which is very important. They're also repairing damage that's been done by radiation and chemotherapy to the intestinal tract. It also enhances immune system function, and people who are more prone to infection due to surgery, radiation treatment, bone marrow transplantation, they've had injuries. you know, where they use parenteral nutrition, when they add glutamine, the immune system function is much more superior than when they leave that amino acid out. L-glutamine is found in the body at higher concentrations than any other free amino acid. So it's the #1 amino acid that's floating around in your bloodstream. Numerous studies have shown the benefits of L-glutamine in strengthening the body's immune system when individuals are under stress, reducing upper respiratory tract infections in athletes who are undergoing high intensity training. We've talked about this before. Also, it may have anti-catabolic effects to give people L-glutamine if they're a burn victim, to slow down catabolism of their lean mass. But it may also have implications if you're exercising and you want to slow the catabolism of your lean mass during exercise. Taking L-glutamine prior to the exercise may actually help to do that. So you saw footnotes, all little references all the way through these slides, and here are the actual references I was referring to, all laid out for you very nicely right there. So after reviewing this kind of research over the years, a few years back, I created Adëeva Ultimate GLX. You know, I made it for myself. I'm over the age of 50. And one capsule contains N-acetylcysteine 300 milligrams, alpha lipoic acid 75 milligrams, L-glutamine 300 milligrams, and the standardized grade of milk thistle at 80% selenium content at 100 milligrams. So this product contains glutathione precursors. It allows your body to make glutathione, you know, more efficiently to raise glutathione levels. But each of these precursors has their own medicinal properties, as we talked about. N-acetylcysteine doing all kinds of things on its own, alpha lipoic acid doing things independently, L-glutamine doing things independently, milk thistle doing things in the liver that some of these other nutrients can't do and no drugs can do. So this is a very, very potent formulation. These are sort of the clinical considerations where I think this product has tremendous value. Anybody over the age of 50 for sure. One capsule a day to help prevent age-related decline in glutathione and glutathione peroxidase, and also alpha lipoic acid, for all the reasons we talked about. Where there's nerve damage, it'll help in nerve repair. About 3 capsules a day is what I would suggest until you have, you know, solid nerve recovery. Certain liver ailments like non-alcoholic steatohepatitis with fatty liver degeneration from non-alcohol induced, hepatitis C, drug or alcohol-induced liver damage, especially from acetaminophen, statin drugs, antifungal drugs, anti-seizure drugs, they do a lot of liver damage. So it'd be 2 to 4 capsules a day, depending upon the amount of the severity of liver damage, or are you just working for prevention? For prevention purposes, let's say someone's using statin drugs or acetaminophen on a regular basis, an antifungal drug, they're on anti-seizure medications like Dilantin, I would give them 2 capsules a day. If there's already known liver damage, I would be giving them 4 capsules a day. In chronic kidney disease, I would give 2 to 4 capsules a day, but this needs to be physician approved, and you also need to be monitoring kidney function. Because anytime you introduce something new into the body of somebody who has a declining kidney function, it forces the kidney to also have to now detoxify or excrete that or process it, filter it. So even though if it's a molecule that can help the kidney, it still makes the kidney work a little bit harder. So sometimes things that you're doing to try to help the kidney in certain situations, it might actually cause too much of a strain on the kidney, and kidney function could decline further. It's hard to predict what's going to happen. Usually in the early or moderate stages of kidney decline, these nutrients are very helpful. When it starts to become more advanced, it might do more harm than good. So you need physician consent. It needs to be monitored. You need to monitor at least the eGFR and the blood creatinine level. People using acetaminophen or alcohol on a regular basis, they should be taking 1 to 2 capsules a day of Adëeva GLX, Ultimate GLX. Patients on 2 or more prescription drugs of any kind probably would benefit. Of course, people with HIV infection, again, that requires physician monitoring. And when you can use it for pulmonary purposes to break up mucus or to improve the function of the lungs, again, that requires physician consent, because these are usually more complicated health conditions. Type 2 diabetes, it improves glucose tolerance and kidney function. I would say 2 capsules a day. If kidney function has already declined significantly, again, you need physician consent and proper monitoring. In Parkinson's disease especially, but also in other neurodegenerative conditions, I usually would give at least 2 to 4 capsules a day as a supportive measure. It's not going to cure the disease, but we're talking supportive. Other intravenous things are going to be required that you probably can't do maybe. So, you really need to see the whole scope of Parkinson's disease and neurodegenerative disease. That's a whole other webinar. I'm just showing you some of the application for this particular supplement. In heavy metal chelation, though, I'd be giving 1 to 4 capsules a day, depending upon the severity of the heavy metal toxicity. Slowing of cataracts, part of the formula is going to be adding this to our high potency antioxidant. And even in polycystic ovarian disease, where you're trying to improve glucose regulation, I would be adding 2 capsules a day of Ultimate GLX to the more comprehensive protocol. Now, let's go back to Parkinson's disease for a moment, because what I didn't tell you is that in genetically predisposed Parkinson's conditions, so 1 in 500 Canadians develops Parkinson's disease. That's probably true in the United States as well, as people get older. And we know that some people are born with polymorphism in that they can't make glutathione that well because they have that genetic defect of that enzyme I showed you earlier, where they can't make a normal type of glutathione. And you see a depletion of this antioxidant in the substantia nigra. And then in the substantia nigra, which is generating a lot of dopamine for its own purposes, the problem with dopamine is that it's a great neurotransmitter, but when it gets broken down, it forms these free radical quinones that can then damage the nerves very badly in that area of the brain. And then glutathione is required to actually neutralize those quinones. But if you can't make glutathione in that part of the brain very well, then the quinones build up and they damage the nerve cells to the point where it then triggers the onset of Parkinson's disease. It's good evidence to show that. And that's why in Parkinson's patients, when you can increase glutathione in the brain, it very much helps to stabilize the condition for a certain length of time while that glutathione is there. But remember that by the time Parkinson's disease even begins, 60% of all the cells in the substantia nigra are already dead. So as you're getting older, to me, it just makes sense, in case you happen to have this genetic variant, this polymorphism in that enzyme, maintaining higher levels of glutathione as you get older by giving your body the precursors is going to help to overcome some of that genetic blockade and stimulate a little more glutathione synthesis and preserve your glutathione in your brain in a way that might help to decrease the onset of Parkinson's disease. That's the way you might want to be thinking about this. That's why people over the age of 50, I really believe, should be thinking about increasing their glutathione levels for all kinds of reasons. So Parkinson's disease, the complementary management involves a number of aspects that are beyond the limits of this presentation. Glutathione and NAC are only part of the story, but in these cases, I supplement the patient with daily oral supplementation of Adëeva Ultimate GLX to maintain glutathione brain levels from day to day. But on a 2-week per month basis or monthly basis, I'm also getting them IV of glutathione and N-acetylcysteine. It's been shown to be very, very effective in helping to decrease tremors and improve their function overall, slow the progression of the disease, something that most neurologists are not doing, unfortunately. Now, here's the caveat here, or the precautionary note, and that is in people that are being treated for cancer. What I did show you earlier, which was a bit misleading, is that people undergoing chemo and radiation therapy, if you give them L-glutamine, it can help to stop some of the intestinal damage to the lining of the gut, which is, it helps them. They don't feel as ill. Unfortunately, cancer cells generally, when they're exposed to chemotherapy or radiation, they switch on genes to try to increase the synthesis of their own glutathione to protect themselves against chemo and radiation. So by giving people precursors like L-glutamine and N-acetylcysteine, alpha-lipoic acid, and silymarin during chemo or radiation, you're actually helping the cancer cell make more glutathione to protect itself, making the treatment less effective. So during chemo and radiation treatment, I suggest you don't give people glutathione or glutathione precursors. That's a little clinical gem to hang on to. The other thing that I mentioned at the very outset of this webinar is that the body makes its own cysteine through the transsulfuration pathway. Here's folic acid. Remember, folic acid has a methyl group, and it hands the methyl group to vitamin B12 and methionine to convert homocysteine into methionine. Then methionine becomes S-adenosylmethionine and gives that methyl group up for all kinds of important purposes. And then it becomes homocysteine again. That homocysteine can keep being recycled this way, or some of the homocysteine can move down through cystathionine and down to cysteine using vitamin B6 in these particular enzymes. Once you have cysteine, you can make more glutathione. So folic acid and B12, and especially B6, are also required for the body to keep making its own cysteine, which, remember, is the rate-limiting step in how much glutathione the cells can make, right? So, and remember that if you have more vitamin C and vitamin E and selenium and beta-carotene and vitamin A in the cell, you're also slowing down glutathione depletion. Thus, a high-potency multivitamin that has those antioxidants at higher doses and a B50 complex to help you can make cysteine more easily helps to maintain glutathione stores. So the combination of the Adëeva all-in-one multivitamin with Adëeva Ultimate GLX is the perfect combination for a lot of conditions. So look at in the Adëeva all-in-one multivitamin how it's helping to support antioxidant function and glutathione function, with the vitamin C, the vitamin E, the selenium for glutathione peroxidase, zinc for superoxide dismutase. Copper was the one I had forgotten about that also supports superoxide dismutase, and manganese. Also, iron is required for the enzyme catalase, an important antioxidant. The B50 complex, so you can make cysteine through the transsulfuration pathway. And of course, lycopene and lutein and bioflavonoids and vitamin A and beta-carotene, all important antioxidants in the cell. So when you're giving the Adëeva multiple vitamin, you're also helping to slow glutathione depletion and improve action of superoxide dismutase, glutathione peroxidase, and catalase. All these antioxidants working synergistically. So of course, you've seen the high potency Adëeva multivitamin before with the whole B50 complex and the antioxidants and the extra calcium for osteoporosis and zinc, selenium, everything down to lutein and lycopene. It's all in one. So here's where the two products, the Adëeva all-in-one multivitamin and Ultimate GLX, work synergistically in anti-aging, especially after the age of 50, for antioxidant protection and energy production and other purposes. Also, because you need B vitamins and antioxidants for liver detoxification, and you need the ingredients in Ultimate GLX for liver function on many levels as well. The two of them work hand in glove to also support liver function and detoxification as you get older. Also in type 2 diabetes and pre-diabetes, these antioxidants and other nutrients improve insulin function, helping to improve function of diabetes and diabetics, slowing down complications or helping to decrease their complications in conjunction with a more comprehensive approach, of course. I'm just suggesting these two work together in these conditions, and also in brain support to support synthesis of neurotransmitters, antioxidant protection for the brain, raising glutathione levels, all the things that are critically important, maintaining superoxide dismutase as best you can so that you don't become susceptible to more genetic onset Lou Gehrig's disease, possibly, as some of the research is starting to indicate. We need more clinical studies with humans to verify that, but what we see so far is very promising. Of course, in nerve repair, you need B vitamins, antioxidants, alpha lipoic acid, and also slowing down of cataracts, as I've talked to you about before, vitamin C and other antioxidants, but also some of the nutrients and raising glutathione levels is also critically important. So that's sort of the 1-2 combination that works synergistically as I apply it for those types of health conditions. So on that note, I want to thank you for attending today.